It's my pleasure to introduce our last keynote speaker, Seth Sternberg. Seth Sternberg does not follow the rules. The CEO and co-founder of Honor is seeking to modernize home health care for older Americans in the most disruptive way. Despite the notion that venture capitalists don't invest in the senior space, Seth Sternberg raised $20 million for Honor. Despite the prevailing wisdom of startups to hire workers as independent contractors, Seth Sternberg hires home health aides as employees at Honor. Despite the fact that many home health aides are paid little above minimum wage, Seth pays them up to $17 an hour and hires the top 5%. Despite the notion that equity should only be for investors, founders, and managers, Seth provides equity and honor to his home health aides. Despite the fact that many home health companies rarely use technology to engage older adults, Seth invests heavily in technology aimed at seniors. Despite, or probably because of his disruptive ways, Seth is one of the most successful and dynamic entrepreneurs in Silicon Valley. We were fortunate to have him as a keynote speaker last year, as a member of our d.health advisory board this year, and are delighted to welcome back to the d.health Summit this year. Thanks very much, Seth.
Thanks for having me. Appreciate it. So I guarantee you that I nor anyone at Honor did not write that introduction. So I'm quite cognizant that I'm the only person standing between you and I think the reception. So I'm going to be very efficient with everybody's time. Ray asked me to come back and talk about a year after we launched Honor, because Honor's now actually been in market for just about 10 months serving customers. And so we've learned a lot, because as a tech company, or a tech-based company, I should really say, a big thing that we do is we just get data in all the time, and then we process that data and we change roughly every 3 days. Like the service of Honor every 3 days gets better because of what we learned from data. And so I wanted to take you through kind of the main lessons of the last year. So first, just in case you guys don't know what Honor is, the quick backstory is I went to visit my mother in Connecticut, and she literally just picked me up at the airport. I got concerned because she was just driving slower than she used to drive. But my mother used to always get caught by like the airplane speed traps, not just the normal speed traps, the airplane speed traps. And so I was like, hey, Mom, why are you driving slower than you used to drive? And she said, well, driving's just harder than it used to be, right? And my mind immediately went to, oh my God, like 5 years from now, she lives in Connecticut, I live in California. What do I do? Because I don't want to be the son who says, I'm sorry, you have to leave your home. Right? So that's how we kind of started thinking about Honor. And as we looked into the elderly space, we discovered that since I graduated from high school, and that's me with my grandmother, nothing had really changed. Like my industry, the innovation technology industry, totally whiffed it on the elderly. And I think that's because investors and entrepreneurs have just ignored the space, largely because I think people think technology and seniors don't mix, which I'll get into. So as we started looking at the senior space, broadly, I went back to my founders and I said, hey guys, like we really, have to look at this. I'm worried about my mother. Turned out Cam was also worried about his mother. So we took fundamentally 4 techies, 3 of whom had actually built large companies before. So I'd built a company that Google purchased 7 years after we built it. Sandy and I built that together, and then Cam had built a company called Plaxo, which Comcast had built. So we kind of had experience building stuff, but we were all techies, and we were like, geez, we really want to start helping the elderly, but the world kind of sees us like this, right? Like tech people who don't necessarily know much about the healthcare system and don't necessarily know much about the care providers, right? The paid care pros who go into people's homes and help them. And so how did we overcome that? And so we started to look at the building of Honor as kind of figuring out the right way to create a really solid base to prop up the elderly, the care professionals, right? The people who actually go in and care for our parents, and also their families. Because if you look at the burden that's placed on the adult children or the nieces and nephews or spouses of the elderly who are in need, the burden's really substantial. In fact, their health can decline over time as they're caring for an elderly person. And like I was saying, as we started to get into this, we uncovered that, because we did some a little bit of math, in 2014, literally 0.7% of all VC funding went into products for the elderly. Yet the elderly spend $1 trillion a year out of our $18 trillion economy. So there's something like that doesn't close, right? That's something's clearly off there. And the first thing that you do when you're an entrepreneur and you say, hey, especially if you're a kind of multi-time entrepreneur, you say, hey, like, I'm going to start putting resources behind this company. I'm going to get a team. I'm going to raise capital. I'm going to start doing this. And you go to the investors and you say to them, I want to build a company that's a tech backbone that's going to help the elderly stay in their homes. And the investors say to you, but we invest in technology, and the elderly and technology don't mix. So, like, why are you talking to me? And then what we pointed out to them is that they're probably not capable of building a car, because I wasn't talking to Elon Musk, right? He would be the one guy who, like, I could not say you can't build a car to. But everyone else who's an investor in Silicon Valley, I can say you don't know how to build a car. And then I'd say to them, like, a lot of the elderly do drive cars, right? I'd say, yes. It's like, okay, then I guess technology and the elderly can mix, right? It's just that your notion of what technology is actually a really outdated form of technology, like a very hard kind of technology to use that presents itself as technology. But a car is technology, but it presents itself as a useful product or a useful service. And so with that effective argument, that's how we raised $20 million to start impacting the elderly and their children. And so when we started getting into how to actually build honor, right? So you've got these techies, and we know a lot about engineering and a lot about what technology can do, but we don't know much about the care professionals. And this is the phrase we kept hearing again and again, right? Everyone told us the care professionals are untenable. Honor was going to fail because they would not show up to work, they'd be late all the time, they wouldn't use smartphones, we couldn't use technology to tell the care professionals what to do, we couldn't guide them in the home with technology because they wouldn't read it or wouldn't bother to read it. So basically our entire thesis was flawed. That's what we were told. And so our first thing we did is we flew to Phoenix and drove to Sacramento and interviewed like 100 care professionals and just said, hey, can you tell us about your life and tell us what works and what does not work? And the number one thing they said is, I am called unskilled labor to my face, right? And I'm treated like dirt by the agencies, and I'm treated not particularly well by a lot of the families that I work for, but I'm a professional. And we took what they said, right? I'm a professional and I want to be treated like a professional. And that actually became the basis for how we began to build the actual product of honor. How could we enable the care professionals to be professionals? How could we enable them to be amazing? And one of the first things we did was actually coin the term care pro, right? Because people often act the way they're treated, and people often act the way they're called. And so let's call the care professionals what they want to be, which is care professionals. And then we did something that's kind of counterintuitive for a Silicon Valley company, which is we hired a labor organizer. Right? Now, you will almost never go to Silicon Valley and sit at the executive table of Silicon Valley and find someone at that table who spent the first 13 years of their life organizing home care workers for labor unions. But that's what Phaedra had done. And one of our investors, Ben Jealous, who had actually run the NAACP for 4 years, introduced us to Phaedra. And he said, Seth, you really need someone who deeply, deeply understands the care professionals. And I was like, Ben, I know. Like, I've interviewed them, but I know that I have not lived their life. He's like, you need to meet Phaedra, because Phaedra not only was the youngest CEO of an AFL-CIO area, but she also did big business. In fact, she was the person who now, kind of interestingly given the news, she was the person who negotiated for Prince to get his rights back from Warner and spun up his media empire, right? So how often do you find someone like that, right, who knows the care professionals and what matters to them, but also, has done big business? So we're building a tech company, but we're focusing on people, right? We're focusing on the care pros, and then we're focusing on the people that we're bringing in the door to be in the office with us to explain to us how to build the right technology for our customer base, right? Know what you're good at, know what you're not good at, and then find people who make you strong where you're weak. So that was the first thing that we focused on, right? The team. And initially it was the team around the care professionals, because we recognized that the care professionals are actually our product, right? Not the technology. The realization was, even though we're a Silicon Valley company with engineers who do machine learning, right? And normally you would say to yourself in Silicon Valley, well, my product is the code that I write on a machine. It's not our product. No customer of Honor thinks that the care professional who walks into their home is anything like that. Care professional is the product. Our technology is not. And that's how the customer feels. And so then this other interesting thing happened. So when we launched Honor, I knew exactly nothing about the healthcare system, like zero. And very quickly, people in the healthcare system started reaching out to us. And they said, hi, I'm a BIPSI participant, and you guys might help me reduce readmission rates. And I was like, BIPSI, look up BIPSI, what is that? And readmission rate, why does that matter, right? Or, hi, I'm an ACO, and I'm fundamentally incented to reduce readmission rates. I'm an MA plan. I don't want people to ever get admitted because I have capitation on my population. Okay, what's capitation, right? No clue, but really interesting that we launched this product, right? Announced this product around sending care professionals into people's homes with a supercomputer in their pocket, right? Your cell phone really is a supercomputer at this point that can tell them what to do and also capture data. And forward-thinking people in the health system said, hey, you guys might actually be able to help on things that really matter to us now. So again, recognizing that we didn't know what we were talking about, right? In this area, we went and found experts. So in came Kelsey, right? And Kelsey was on the startup team. She was the 5th person to start in CMMI, Centers for Medicare and Medicaid Innovation. And Kelsey was a VP at United after that. Kelsey started the bundled payments program at d.health and took it to market. All right, so Kelsey, I think I was 5 minutes into my meeting with Kelsey. It was supposed to be Honor meeting d.health when I asked her, why do you live in Washington, D.C.? Literally. And she said, well, not sure how much longer I'm going to be living here. I might be moving to Boston. And I said, wrong direction. Come to California. And 2 weeks later, she was an employee of Honor. Right? But again, it's really counterintuitive, right? You're building this tech company that's theoretically about the bits and theoretically about the code, but you're actually just concentrating on the people, right? And so it was bringing someone in this case, who understood health. But then we really needed more, right? We needed people who fundamentally understood, people who practiced, right? People who had worked with customers, patients, day in and day out, who'd built businesses around it. And so actually at this conference last year, I met Dr. Leth, who you all just heard from. He had shorter hair when this picture was taken. He looks much cooler now, though. And so we asked him to help us. And so he became an official advisor because we needed a practitioner, right? We needed someone with the depth of experience where we could go and say, hey, if we began to do this in the home, will that actually help? And what if we interfaced it with the health system in certain ways? Like, would that be valuable? And one of the things he definitely said at some point to us was, don't give me more data. I don't want more data. Give me actionable data, right? And that's deeply informed the kind of health systems-oriented product that we're building, right? Because he said that to us. So it's getting the people right. Dr. Greeno, who was the founder of Cogent Health and now is the Chief Strategy Officer at IPC. Or Carol Raphael, and I think Carol was here earlier today, yes. So I met Carol last year at this conference as well. So I really owe Ray a lot because I found 2 of our best advisors here a year ago. But the thing about Carol is having run the Visiting Nurse Service of New York for 2 decades, she understood deeply the actual situations that Honor would face when we went into people's homes, right? And she deeply understood not just the customers, but the lives of the care professionals, right? Because she also had this very large workforce of home care workers. And so what really motivated them, what made them perform extremely well, what made them provide great service? So the people again. So that was the beginning of Honor, right? And the big lesson up to this point is you think you're building this tech company, you think it's about the code, and it's actually not about the code at all. It's all about humans, right? Which for Silicon Valley people, for tech people, is frankly very counterintuitive. But you're concentrating on the human, the care professional, and then you're concentrating on the humans who you're bringing into the office who can make you fundamentally better and then make your product fundamentally better for the end users. And now let's add the technology piece, right? So now let's mix in technology, something that's just really simple, like making it possible for the care professional to write a note after every visit into their phone, and then that note just appears magically as an SMS or in a user's app or as an email, however they want to receive the note. But now you, as the adult child of a parent who needs care, you now see what's happening to your mom every day, right? The black box of kind of, did the Care Pro actually even show up? What did they really do in the home? Like we've now opened a communication channel, right? And technology makes that possible. That's pretty simple technology. And simple technology makes it possible for you to rate those Care Pros, right? And tell us how you think they're doing, or to send you an automated bill based on GPS. But then technology can actually go deeper. And so something now, speaking kind of more from a tech point of view, that's counterintuitive, is that the stuff that we all look at on screens, like the pixels that we see, that's really user experience stuff. It's not actually deep tech, right? Deep tech kind of almost does things in the background on servers that just makes our lives better, and we don't necessarily know it's happening, but it's occurring, and so I want to give you guys some examples of that. So here, if you think about the needs of your mom, like picture your mom in your head for a second, and think about all the unique needs your mother has. Maybe your mother speaks a certain language. Maybe she likes a certain kind of food. Maybe she has a love of cats, and so has 5 cats in the house. So if you ever needed a care professional for your mom, they better not be allergic to cats or they're going to be sneezing all day. And what do you do when that care professional is sick one day, right? How do you backfill them? So it turns out that the matching of your parents' very unique needs with the very unique capabilities of a care pro, even something like, is that care pro trained in dementia, right, is very, very hard. It's not as simple as get me a car, I want to get into a car, right? That's a homogeneous product and a homogeneous user base. Here you've got really heterogeneous product, the care pros, and very heterogeneous needs. Computers are really good at matching that. So this is what's called a Gaussian mixture model. And this is actually real data on the San Francisco Bay Area. And what this is doing is red is good in this case, and the lighter colors are bad. And the computer is asking itself, where is it easy and hard for me to fill demand? Right? So where is it simple? Where is it difficult? Now, you know the model's good because I know it's a little bit hard to see the map, but the very, very light area that's kind of blue right in the middle, that's the San Francisco Bay. So it turns out it's very hard to get a care pro to the middle of the water. So the model works, right? What you also see that's kind of fascinating here is, the mid-peninsula is very hard to get care pros to. And actually, intuitively, that makes sense because care pros often live in the East Bay. Customers often live on the peninsula. And the problem is they're separated by this massive water feature called the San Francisco Bay. And there are only 2 bridges that connect the two, right? And so then you take this data and you say, well, what do you do with this data? Well, maybe you price discriminate, right? Maybe you actually pay care pros more who are able to serve mid-peninsula, right? Who are able to make that drive. And then at the same time, you charge customers a little bit more, right? Because they live in a geography that is harder to serve. And so you have to get, you have to pay people more to get to that geography. So data to, create a better service for everybody. Care pro ratings is fascinating. So I'll give you an example. This is actually some of the variables we stripped out for the purposes of public discussion, and those are care pros' names blurred out. And these are some of the variables that people are automatically rated on. And there are actually many more. And let me give you, you'd say, wait a second, I thought people just got, rated 1 to 5 stars. Well, what if a care pro only works at one house? And what if that house just always rates people poorly? What do we do, right? Do we punish that care pro because they happen to work for a house that always rates people poorly? Of course not, right? We need to find other ways to normalize that data to know that that care pro might be amazing even though they're working on a really, really difficult customer. Or what does it mean when a care pro is late frequently, but by just a little bit, 3 minutes all the time, versus occasionally a lot, right? Like an hour. How do you score that? And what you find as you mix all this together is you can basically cut it into 3 scores. How engaged is a care pro with the platform? How reliable are they? And what's their quality of care? And if you think about it, what that does is that feeds into who gets what jobs. And let me give you an example of what we learned from that data. So I want you to all ask yourselves a question. Would you prefer a care pro who's really great at customer service or who's a really high skill for your parents? Get your answer in your head. Okay. So we never asked customers this because people are actually very unreliable at answering that question. But it turns out the answer is if your mom is pretty healthy and she just needs some help around the house, a couple hours every other day, you value customer service. If your mom is really not very healthy, maybe she's reasonably deep into dementia, maybe she is, pretty, relatively advanced diabetes, now you value quality of care, right? You value skill. In bedside manner, you just don't care as much. And the way you can infer that is you can look at the customers, cut the customers on different variables, look at how they react to care pros who've been ranked on different variables, and then figure out what matches actually work over time, right? And so what's amazing is, if you think about it, what we're now doing is getting to the point where we can match on personality, right? Because what we humans usually do when we say, I just like this person, or I just don't like this person, is we kind of call that personality, right? And we don't really know at an explicit level what it is about that person that we like or don't like, but it's just a bunch of little things that we have trouble articulating, right? And that's what we really want to get to, and with data we can get there, and then provide a dramatically better service to people. And this one's fascinating. Another example of data. This is a real trace pattern that we pulled from our database. So we only accept 5% of care pros who apply to become part of Honor. A care pro checked in on the San Mateo Bridge saying that they were at the home. But the visit location was in San Francisco. Oops, not good. They were running late, right? And they didn't want to appear late to our system, and so they checked in. This happens all the time, right, when it's not being traced. And once we started looking for this, we saw, occasional occurrences of it. Once we started popping that window on the right that says GPS indicates you're not at the visit location, are you sure you want to begin your visit right here? Surprisingly, care pros started showing up on time more, right? Because they knew it was being watched. But this also goes the other way, and that's an important thing to understand, because customers with dementia absolutely will call their daughter or son and say the care pro didn't arrive or the care pro was late, and we'll get a call from that family saying the care pro was late. And we can say to that family, oh, we're sorry, but we know with certainty that the care pro was there on time and they stayed for the full amount of time, right? So it really cuts both ways. Another example of using technology in really kind of counterintuitive ways. This is not really pixels on a screen, right? It's all this stuff happening on the servers that's just making the overall experience better. Sick care pros. This blew my mind. When we showed our care pros the place in our app where they let us know that they're sick, so we have to backfill them, because with scale and with tech, you can backfill very quickly. They were unbelievably excited by that. So much so that I interrupted that training session and I said, why are you guys so excited? And they said, because we're not allowed to be sick. And I was like, you're not allowed to be sick, but you're a human. And they said, well, the agencies are too small, they can't backfill us. And so we have to, go in to help folks even when we're sick. And then the person who runs caregiving for a very large medical institution told me her father got a lung infection from a sick care pro. Right? Happens all the time. But with scale and with tech, you can avoid that. So this is a real customer call. Let's see if it works.
April of 2015,
this came to our call center.
Every month, my mother was in the hospital. In the last, since you guys have come aboard in December, she hasn't had to go to the hospital. And I wanted to tell you that in person, because that's what I'm trying to send this email for. So I want to thank you, and I wanted you to tell whomever, the people, all the people, thank you very much. This is the first time Some of the pressure has been off of me from taking her to the hospital. And your crew, your people that you sent here, you tell whoever runs your company, thank you, thank you, thank you.
So, at the end of the day, what I really want to leave you guys with is I think technology can make almost any experience better. But in the case of Honor, in the case of caring for the elderly, and really caring for our care professionals and then caring for their families, you actually start on the human side, right? You start with the care professionals and you figure out what technology can I do to enable them to be massively better? How can I build a system that can be really efficient so I can pay them a little bit more, so that I can guarantee them hours so that they know that they can pay rent next week, right? To tell them about a customer before they ever walk into a home, and never send them to a home that they shouldn't go to because they're a 90-pound person and the person in the home needs help getting out of bed and they're 300 pounds, right? So it's actually a human company, right? It's the human care pros that we're helping. It's the humans in the office that help us figure out what to do. And then the technology works as kind of a backbone or an infrastructure to make it all better in ways that are not necessarily intuitive. So with that, if anybody has questions, feel free.
Really great talk. Thanks for sharing all of that. I was curious, as you were forming the company, how did you figure out how deep to go with services? Because I could see this turning into, say, a Medicare Advantage plan.
Yep. Yeah. The trick with entrepreneurship in general is at the start, you know exactly what you want to build like 20 years out, right? And you desperately want to build it today. And then you might be in an audience like this and someone might ask you a question and say, you should really do this. And you're like, I know, but I can't do it yet, because the thing that kills startups is lack of focus. I mean, that is when they die. And so you have to pick something that you really narrowly focus on, and you better make sure that that thing that you're narrowly focusing on is a sustainable company in and of itself, right? Because if not, you will also die. So you pick something narrow, but that can be very large, and that forms a base to then do so much more in the future. But Uber didn't start doing Uber Eats until, like 7 years in, I think. Google tried to do an enterprise product 3 years in, and then they scrapped it, and they did it again like 7 years in, right? Enterprise search. So like in the case of, if you look at the companies that have become massive, they almost always start really narrow, and they stay narrow for a very long time, and then they add on as they get more heft. Any other questions?
I had a follow-up real quick, if that's okay. Just
sure,
related to that,
yeah.
how does what you do compare with Clover?
Yeah, Clover's great. So I've talked to them, and I think that what they're doing is awesome. Clover, they are actually a plan, as you know. And they are going to the home more on the medical side, right? And their visits into homes will tend to be more transactional. So a nurse practitioner might call a home or visit a home kind of quickly, as I understand it. I don't know Clover deeply, but this is what I understand from chatting with them. Honor is much more a long-term relationship over time between a care pro and a family. It can be 24 hours a day, 7 days a week. It can be 1 hour a day, every other day. The probable average is something like 5 or 6 hours a day, but the spectrum is super broad. So Honor is really about helping people with activities of daily living, like get out of bed, get food, get dressed, get bathed. I think Clover's more targeted on let's just fundamentally keep people from admitting. We're more let's keep people in their homes. And you had a question?
Can you tell us a little bit more about what the technology is?
The question was, can I tell you a bit more about what the technology is? So I'll do that really fast because I'm worried it'll be boring for a lot of people. But the stuff that makes all that possible in the background is a bunch of very advanced machine learning that has to be written in C++ because Python's too slow and has to run on super powerful machines. Yes? Oh, okay. Sorry.
What do actually provide in the home with the
Oh, okay. The question was, what do we provide in the home with care professionals? So, so I would say everything that I just showed is actually the deep technology. When a care professional goes into a home, they have an app that gives them client information before they ever walk in. They have an app that gives them a care plan that they follow in the home. They've got notes that all the other care professionals have left who've previously been on that home for each other. So there's lots of things, basically information that the technology gives to the care professional to make them better in that home, either to follow a care plan. In fact, we just announced something with American Cancer Society where soon when care pros go into homes with people who have cancer, their care plan will be different because that person has cancer. So for example, the nutrition suggestions would be different in the care plan. So that's one kind of technology, but then there's this hidden technology that's making sure it's just the right human, the right care pro going to that home in the first place. And that's oddly a little bit harder technology from a technologist's perspective than, for example, a client profile, albeit the client profile is very valuable. Yeah.
How is Honor participating in risk in risk sharing and any kind of reimbursement in that environment? And how do you see it progressing in the next few years?
Yeah. So how's Honor participating in risk sharing? So like I said, the health systems came at us reasonably aggressively when we announced. Traditionally, non-medical home care is private pay. So it's a $30 billion industry. It's 70% private pay. And the 30% that's not private pay is either long-term care insurance or Medicaid. One of my big goals is to be able to reduce the ultimate cost to the end consumer of non-medical home care. And if non-medical home care is able to use data to show that it's actually fundamentally affecting people's health by either affecting admission or readmission, I think at the very least we can start to bring the cost down on the end consumer by at least sharing some of the cost. Maybe that's post-acute, right? Maybe 100% of the cost is taken by an institution post-acute on certain DRGs, maybe in a high-risk population, et cetera. Maybe there's some shared cost if someone's on a Medicare Advantage plan and it makes sense to that plan to send home care into that home. We have some trials underway there that we don't kind of talk about too much. As a company in general, we like to get things pretty solid before we talk about them. But it's an area that I think is deeply interesting because if you think about our ultimate goal, it's something that we would focus on pretty strongly. Stephen?
Do you see in-home care as a national brand, or are you thinking about things more on a regional basis?
Yeah, that's a really interesting question. So do we see it as a national brand or more regional basis? So we started in the San Francisco, actually we started in one county in the San Francisco Bay Area. And then we expanded to the whole San Francisco Bay Area, and now we've expanded to LA. What's interesting is you basically cannot find an example of an owned and operated home care company that's expanded across the country. They're all franchises. And the fundamental reason we've come to realize is as you grow your revenue and scale, because of some of the stuff embedded in here, if you think about it, it just gets too complex to operate, and your costs outscale your revenue, and you have to stop growing if you want to operate a business. And fortunately, with technology, you can get economies of scale rather than diseconomies of scale. And I think it's actually a serious disservice to the elderly and to their kids and to the care pros that there is no national brand that they know that they can turn to for help with their parents in the home, because it creates a lot of confusion, right? Like in today's world, most people don't know the word home care, don't know the word caregiver. Like no one knows those words. And then their mother, either leaves a stove on, or they recognize they need some help, but they just do nothing because they don't know where to turn, or their mother falls and breaks her hip and is coming out of the hospital, and they end up in a desperate search, and they don't even know the magical word to put into Google to get Google to spit out the right results, right? And that's because there is nothing that kind of stands for caring for our parents. And I think that part of what I'd love to try to do is fix that. So I think national is actually really important to achieve the end goal.
Great. Just to build on that question, how do you think about new market entry and scalability?
Yeah, that's a really good question. So one of the things so we've never announced anything on going to markets other than SF and LA. And the reason for that is building a service like this requires nailing all of the systems around making the care pros excellent, and then all of the routing and efficiency of those care pros, and then how to match them up with and find customers. And that is an extraordinarily complex thing that I just described. And if you try to go to too many markets at once, your quality will break down. And your operations will break down, and then you'll start fighting fire drills rather than building for the future. So you'll be actually building for problems that exist only because you tried to scale too fast, rather than building for innovation that makes the entire product better. So we see expansion as ensuring that Honor gets really stable and really excellent in the markets that it's in before we then expand to more geographies. And we'll expand very aggressively to more geographies when we know that we will be as excellent in the next geography as we are where we are today.
Hi, can you comment on your current interface with the health system? And you talked about post-acute, and so how do your staff communicate with healthcare providers?
Yep. So when people, oftentimes we pick up people from discharge at a hospital, discharge at nursing homes. I've been surprised that, for example, they don't want to hand us a care plan. They want us to come up with a care plan. Like, that kind of blew my mind. And we've actually now gone HIPAA compliant, so we can send and receive data. But it surprised me that HL7 files, which is the file format that people like to talk in this particular industry, were considered to be complex. It's just a friggin' data format. And I think that the most interesting stuff around the health system, because today it's they don't, the nursing home doesn't want to give us a care plan. If we take a discharge out of the hospital, we're doing the assessment and creating our own care plan still. And we are, one of the things that's been most interesting to me is some people who discharge into Honor actually do want feedback on how the customers are doing once they've discharged into Honor, and so that is occurring today. There are some, I think, amazing opportunities to do exactly what Dr. Leff talked about around giving people the right data at the right time when it's actually actionable, but we haven't talked about anything there yet, but we think about it deeply.
Seth, thank you so much. It's inspirational.
Absolutely. Thanks for having me.
Yeah, thank you. I want to thank every speaker and each one of you participants. Seth came all the way, leaving his busy, fragile startup out of California to come speak for us. First and foremost, I want to thank all of you for sharing the day with us. We still have a great sunset reception with live music, drinks, and food. So share some few minutes with us. We are running till 6 in the evening. You can network, talk with others, share experiences, and so on. We got participant speakers coming from Europe, from all over the US, and we greatly, greatly appreciate it. One of the challenges we talked about today is I tried to summarize some of my lessons, my takeaway from today, is that paying physician is a very complicated problem. And I love to study medical history. So one of the great physicians of the Middle Ages was a guy who lived in Egypt named Maimonides, Rambam. He was the private physician of the Sultan of Egypt in Alexandria. After serving the Sultan for 30 years, he took some courage and said, Your Honor, I would like to get a salary raise. Some physicians would like to get a raise after 30 years, okay? People say I'm the most famous, the most effective physician in the world. I've written books. They come to consult with me from all over the world. I think I deserve a raise. If you annoy the Sultan, they cut your head. You have to be careful when you approach, okay? So the Sultan said to him, with all due respect, doctor, you know, you have been my personal physician for 30 years. But I don't know how good you are because I've never been sick. And his answer of the physician was, that's the point. Okay. So how do you pay a physician when you never get sick? This is a serious question because one of the things we have learned today, we still, as we speak in 2016, do not have the right incentive, the right model to do preventive care, community care, but we know a lot of action needs to take place there. One thing we know a lot in University of Rochester, I've been privileged to work with Dr. Bigelan and Dorsey. When we do the research on telemedicine, primarily on chronic care, we find several important things that I want you to recognize. One is when it's done right with the right physician, with the right condition, primarily we did it for Parkinson's disease, but for other conditions as well, you really get superior clinical outcome. Patients love it because it reduces the travel cost. It reduces the time. When you are with the wheelchair, even going 2 miles can take a whole day for yourself and for your caregiver. But it also provides better productivity for the caring physician because a 30-minute face-to-face visit can be reduced to 15, 20 minutes online visit with equal efficacy, and physicians don't feel shortchanged at all. So we get much better outcome at a faster rate, and we've seen it in many other cases, pre-surgical visit, discharge follow-up, and so on. So there are many ways besides just urgent care to use telemedicine and technology. Everybody talks about value-based care, value-based payment. The definition of value, as we heard today from Clay Johnson, is quality divided by cost. The only problem in medicine is how do you redefine quality? That's a challenge, it's an open issue, and I want you all to think about it because the standards of quality we have today really were defined for white, middle-aged males, and it's not exactly the cross-section of all the population we take care of. So that's another issue. We learned today that the aging population in all the developed societies, thanks to medication, sanitation, good care, is growing up very rapidly. It's going to be a growing segment of the population. As the number of children we have, the number of grandchildren we have kind of shrinks. As the population goes up economically, the question is who will take care of the top of the pyramid or the inverted pyramid. You see it in Japan, but this problem will come to us as well. This is a serious issue. Many of those who cross the 60, 65 years old boundary do not have the money to sustain their survival. So it's a big political and societal issue. The other thing we learned that this population, when they come from care, they don't come alone. They come with friends, family member, caregiver. And how do you take care not just of the patient, but the people who come with them, the people who take care of them when they're not in the physician office? How you get them engaged, how you provide the love and the mental power for them before everybody collapses. What we heard today is there's a lot of experimentation going on around the world of relatively low-tech solution, but with phenomenal impressive outcome. We saw from Holland the Parkinson's disease network, where a lot of the care is shifted from the hospital to the outpatient clinic into the community with some amazing results. Some experimentation come to the US. Aging 2.0, looking at designing, accelerating new technological initiative, trying to get more VC money into the baby boomer aging rather than how do you order pizza a few minutes faster, okay? We had Frog Design looking at some amazing work about how we extend the transition from being independent to being transitioner to being struggler. And we can do it with extended the housekeeping, with telemedicine, with group support, and so on. We had a lot of new companies doing amazing things with this TouchCare, Pager, Honor, American Well, Doctor on Demand, Grand Round, and others. So there's a lot going on by the private sector as well as the government is doing some amazing things. But there are many issues I want you to think about for which we really don't have solutions. One is how to better get the physicians, the family member, and the patients get more engaged, and how do we make sure individuals take charge of their own health care, not just when they become elderly, but middle-aged and even younger. Part of the reason our healthcare costs are going is because the population is sicker. We have more morbid, heavier patients, people exercise less, there's more stress around, and it takes a clinical toll on anybody. Other question that are still open is how we integrate telemedicine and mobile technology with the current electronic medical record system. Hospitals spend tens of millions of dollars of putting Epic Center and McKesson EMR system all over. But when I'm going to urgent care or I call it telemedicine, they may not have access to my current list of medication, to my allergies, and then they prescribe another medication which is not backfilled into the hospital EMR, or the patient moved from Florida up to New York or to Arizona for the winter. So these are serious issues. If we fail to do it, we'll get bad outcomes. The other question that comes around is we want to use technology, but how do we help the frail and the elderly use technology? The other problem is they may not have the cash to pay for smartphone. You know, smartphone, they cost you $100 a month. Can they afford it? It looks easy, it's fun, entertaining, but they may have to give up some meal to get it. So should the third party subsidize the use of this technology? Another question that we would like you to leave us notes when you write your comments on this meeting is, what are the key policy implications that we should share with the next administration? We plan to write a comprehensive white paper summarizing all the questions and issues and solutions we learned about today. We'll share it with all of you. I hope all of you are subscribing to our d.health Digest. We are over 15,000 subscribers, and we're building a community of serious leader individuals who are interested in doing a better job in this dimension. So I really want to take this opportunity to thank you all for coming over today, and give a big hand for all the staff, the organizers, and please join me for the reception, the live music, the food and the drink. Thank you very much, and hope to see you all next year. Thanks a lot.